Well, life is really about handling stresses, both eustress, good stress, and distress, bad stress. And when one is exposed to a very negative or horrific situation, a lot of it's about making choices. And for me, it was about focusing on all the wonderful things that had happened that had gotten me to that point, and not focusing on the negative and very negative things that went on. And I think that's important for us to share with our patients, that it's not always about changing what fate throws our way, but how we choose to look at it and use it as a motivation to go forward, or to succumb to it and then allow it to defeat us. We read a lot about various fad diets. And I think the problem we have in America, really worldwide today, is who do you believe? You know, the Mediterranean diet sounds good. You know, I think it was one of the old Woody Allen movies when they go to the future and they say, no, what we really found out is hot fudge sundaes every day is what keeps you healthy. I think this has created a problem, because who do you believe? Does someone have a vested interest? Maybe, green tea is good, but it's just being produced by someone who makes green tea. So I think what's important for me, and what I like to share with my patients, is life is about a balance. Homeostasis isn't about a fixed point. So I think a healthy diet, I think there are some core issues that are important to keep in mind. Probably a whole lot of red meat isn't too good, but probably a whole lot of anything isn't too good. I think this is where clinical science becomes important, so we can study these in a way that makes sense to people that they can understand. Using scare tactics rarely works. It might work for a few minutes, but then people are going to go to what they enjoy. So I believe when it comes to exercise, do exercise that's enjoyable, let the body move. There's no one particular form that's better than others. I think diet, a good, healthy, well-balanced diet is important. I've never been a huge fan of fad diets, but let's let the data tell us. And I think what we need to do is present it in a way to people as a positive, not as a threat. Thou shalt do this or else. I don't think that really plays as well. I think there was a number of excellent presentations today about how do we deal with teens. And I think it's very important to understand that teens think differently than children, than young adults, older adults, or much older adults. That teens have their own issues to deal with, and I think one needs to be sensitive to some of those issues. Not all teen goes through the same problems. I was an athlete. Teens who are heavily involved in athletics have different issues than teens who are involved in other activities. The role of the peer group has demonstrated to be very important. There are a lot of good teens who have done well despite bad backgrounds, and there are some teens who come from wonderful parents who get involved with what we call, unfortunately, deviant peer groups, a bad word, but the desire to want to fit into their peer group will oftentimes trump many of the important issues that they might have learned as children. So the idea of not laying blame, but understanding what does motivate the behavior, what are the important issues for a teen, and using that knowledge in a positive way to help guide their behaviors in a way that ultimately is something that they probably would choose later on in life anyway. Well, I think it depends on what you define as the medical model. I think some people take a very narrow view of the medical model, as if it's only about biology and neurochemistry and neuroanatomy. My belief is the medical model is quite effective, but I take a far broader view. To me, the medical model very much incorporates biological issues, psychological issues, social issues, and spiritual and lifestyle issues. So I guess it depends on how you define the medical model. And I believe the best medical model is one that is more inclusive of all the potential factors that could influence health and behavior. I think it goes back to the prejudice that people have. I think we see the same issue in the field of psychiatry. What we don't know or understand, we sometimes have prejudice, we prejudge. I think the issue that drug and alcohol is a disease of choice that people choose. I always tell my students, I don't know of a single addict that I've ever taken care of who said my life goal was to grow up and become a drug addict or an alcohol abuser. But I think it's this issue. I think what we're seeing in the way of a change is the wonderful advances in neurobiology so that we're destigmatizing it a bit. So yes, there is a biology to addiction. There are changes in the brain that take place. And I think hopefully we'll see a change over time. It's changing a culture. Cultures change slowly. Certainly within medical schools, the science is coming forth, but they're very packed curriculums. So I believe as we make more scientific discoveries, understand more about the role of epigenetics, how we're raised, the environments we're in, and they affect our brains, that hopefully that stigma will change and we'll move to a new era, a culture, as it were, of understanding this as a disease that needs to be treated, but clearly is affected by a variety of factors. Well, I think the philosophy that I was trained with as an osteopathic physician, as a DO, was really, you didn't focus on one particular organ, but kind of how the body was all interconnected. Now, certainly in the area of neuroscience, this has been some of the most exciting work that's been going on for the last probably 5 to 10 years. It's not just focusing on a particular synapse in the brain, but it's really looking at how the brain communicates with itself. The brain tracks, that the brain can't be viewed in this narrow way. The analogy would be trying to determine how long it's going to take me to drive back to work and only look at the traffic patterns getting out of the parking lot. Getting out of the parking lot is important, but what's going on the highways, getting there, and the parking lot that I'm going to, and I think that's what we're seeing is the approach and the philosophy that I was trained in was really to understand things, how everything interacts with each other, the interconnectedness, and how things in one area affect something very far away. And I think that's what we're seeing now, that we've gotten away from this very myopic view of just looking at a synapse and particular monoamine neurotransmitters, and really looking at how the brain kind of communicates with itself and then with the rest of the body.